I get Washington Post notifications. Just got one. Marriott discloses massive data breach affecting up to 500 million people. So, here we go. So I'm here to talk with you about my anxieties, my professional anxieties. Yeah, so you're my counselors. And what I'm going to be talking about is the work that I do internationally in working with developing countries to move them in the direction that we are now and where we are headed. And the anxiety comes in that I think about where we are headed and how little we know and how less prepared many of these countries are to deal with it than we are. So I'm anxious about what we're walking into or what we are helping people walk into. My title is just Pixels, right? It comes from the fact that when we talk about collecting things, information that is objective, it's often numbers. Pixels, of course, are zeros and ones, even the simplest of numbers. And when we think of things that are objective, we tend to divorce them from ethical considerations or moral considerations. Not all the time, but it's kind of a gut instinct that we have that, at least in our modernist perspective on things, that objectivity is something that everybody can recognize and follow. That's the whole idea of rationality. Well, we all know, and probably we're here today because we recognize that's not so. So let's start with the disaster. I just mentioned one about Marriott, but this is one that is about ransomware on a health system in the U.S., Indiana. Ransomware is where the system is hacked, the information is made unavailable to the hospital, and you can get access to it again if you pay a ransom. And the reason that this is becoming much more popular, if that's the word we can use, much more common today, is because health data are so rich. They are richer than bank data. They have a ton of information on you. And so, and then a hospital supposedly has money, much more money than you are going to have. So the hackers are going to go to the hospital and hold these data hostage until the hospital pays. So there's just a little glimpse of one of the hazards that we have when we have masses of data. But now let's back up. What do I do? Why am I here? I work in health information systems in developing countries. Low and middle income countries, you'll see the acronym up here, LMIC, eventually. And we work along this continuum where the project, we're working towards better systems. We have things that we do that help a country have a strategic plan for the health information system. Let me just note, I'm talking about countries, whole countries. I'm not talking about particular hospitals, but a whole country and how they guide their public health. We help them with their governance in the information systems because the data come from so many different offices and bureaus. It has to come together for the decision making. And then those systems need to be digitally interoperable. We can assess and improve their data quality. You all know the phrase, garbage in, garbage out. We have to make sure that when you see those data, they can be trusted and used. And then we help them make decisions with those data. We equip them for data analysis, and we provide them with mechanisms for informing decision making. And we have help, they can help them to allocate their resources to the places of greatest need. Just think for a moment, right now, the epidemic in the news is Ebola in the Democratic Republic of the Congo. So where are the villages that are having the most cases? What are the resources they need? How are we going to get them there? How long will they last? Where are the personnel? Are they in the right places? These are all decisions that need to be made really fast to stem an epidemic. So with these kinds of resources, we help them make those kinds of decisions. We operate in more than 40 countries. So DRC, just talked about it, right here. I think the epidemic is probably on the eastern side. And Yeah, we work with HIV, we work with malaria, tuberculosis, nutrition, and Ebola. So there's the LMIC, where are the low and middle income health information systems now? They are, many of them, paper-based. This is taken from this photo from our work. So much of the work that we do is helping them to have high-quality paper systems, but then quickly moving them on to the digital. With these paper systems, there's lots of fragmentation. Everybody has their own system. They are not talking to each other in many instances. There's lots of duplication. They're not standardized. Some of them, too many of them, are in relationship to the donor, because there will be either a foundation or a bilateral country that is giving money for something to be done, and they have their own reporting requirements, and so often the data are collected to report back to the donor, not so much with the interest of the country in mind. And too often, those data are of low quality. So that's where we are now. Where we are headed now is to digitization. So here we have the use of a tablet. I think this is in Bangladesh, and data are being collected with these tablets. This is, I think, reproductive health, visiting, well, obviously that's not a pregnant woman that he's interviewing there, but in Bangladesh, we have one of those programs where we're interviewing pregnant women and looking at childbirths. We're at the same time looking at deaths, and those data are then automatically, through the digital system, shared with the census so that they can adjust their figures. They can do intercensal estimates of the populations, so that interoperability is built into the system. So where there is power, there is ethics. Data is very powerful. Greg gave you many examples of the power of data. I'm giving you some examples of the power of data. It allows you to do things quickly. You can be very targeted. But those of you who have watched any of the Spider-Man movies know that there was an evil Spider-Man at some point. Maybe one of you can tell me which movie it was. I can't recall. But that power can be used for good or for ill. And then, just to finish with this analogy, we have Uncle Ben, Spider-Man's father, who said, with great power comes great responsibility. So we are here to talk about that kind of power and that kind of responsibility. So let's look now a little bit further, a little bit deeper into these developing country settings. What kind of responsibilities are they able to exercise? We, and by we I mean myself and some other folks in my project, went into Kenya and Tanzania, and we found the key influencers for health information systems. Those who, if we were to implement systems to guide the ethics of the HIS, they would have the power to do it. So we gathered them together, and we asked them, what are the documents that you have to refer to that guide you in the ethics of health information systems? We pulled those together, and then we also interviewed them. In Kenya, we were able to pull them into one room. In Tanzania, it was one-on-one conversations, asking them, what do you have in place? How's it going? What are you ready to do? What do you need? We found that they reported, actually, first of all, looking at the documents that they pointed us to, that the documents were weak or they were non-existent legal frameworks for data protection. They didn't have the legal framework to tell them what to be doing with those data. They lacked a dedicated unit to point to that says it is your responsibility to take care of this, not to mention the skilled staff to work in that. They had inadequate capacity to effectively implement secure information systems. They were aware of much of the language, but they felt like they had nothing to work with. They could participate in a conversation like this. They could name the issues where the ethical issues were arising, but they didn't have the wherewithal to respond to it, to develop a system that would be more protective. What they wanted was an institutional framework for data governance to oversee digital data ethics. Data governance, watching over the data systems. This is something that Greg just suggested was necessary. Data security, when I talk to people about data ethics, the first place they run is data security. Now, it's rightly so. I mean, if you stayed at a Marriott recently, you're probably thinking, what was the information I shared with them? And you're concerned about that security. So it's logical to go there, but that's not the place to stop. There is a lot more. So one of the things that we did in measure evaluation was to look for sets of principles that guide data ethics worldwide. We did an exhaustive search. We were looking for sets that were global, not in the geographic sense, but in the sense of all the aspects of data. So there are additional sets that we didn't capture that do a deep dive into security, but we were looking for things that would cover a much broader range. We found 11 sets of these principles. I've got 2 of them here that you can't read because they're too small. But I'll read this one for you. These are the principles for digital development. It starts with design with the user, understand the existing ecosystem, design for scale, build for sustainability, be data-driven, that's use evidence to build your data systems, use open standards, open data, open source, open innovation, reuse and improve, address privacy and security, be collaborative. This is from U.S. Agency for International Development, and it's about developing systems for whole countries. This one over here comes from a healthcare company. These are principles for healthcare. Talks about accountability, transparency, integrity, etc. There are 9 more of these, and when we pulled them all together, we found that there were 34 principles, unique principles in ethics pertaining to data to pay attention to. Security is just the beginning. So where are the developing countries headed? This is the second time I'm addressing this topic, so it's looking a little further down the road. After we deal with the standardization, the interoperability, the digitization that I mentioned before, we go into the use of existing data. And let me take this off so we're not thinking about that. The use of existing data, there's less patience for deliberate cohort studies, where you identify a group of people, you follow them for a period of time, and you study what's going on with them. They want quicker answers, not data collected for a particular purpose. So let's just use the data that are available. They might be talking, well, they're going to be using data that are collected routinely, like from the census, but also beginning to look at data sources like cell phone companies. What can we learn from where people are moving, for example? In developing countries, there's a lot of movement between the village area and the cities. People will have 2 residences, or they will live in the city and have a home residence in the village. And there's this within-country migration that happens all the time. That can have an influence in the spread of a disease, if that can be monitored. So there is an interest in looking at those kinds of data. Machine learning, because the data that exist are often large data sets, how can they be used to identify patterns that wouldn't be detected easily unless you spent millions of hours looking at those data? A machine can do it much more easily. A machine can also identify data inaccuracies and sources of data inaccuracies so that we can focus our energies in improving the quality of the data. And then decisions by algorithm, because again, once you are dealing with large numbers, whole populations of a country, you have to automate the decision making, automate where the resources need to go. Now, I suspect this is going to be a topic that's addressed multiple times throughout the day, the use of algorithms. Greg mentioned it. But I'm going to mention 2 books that address it. The one on the right, Weapons of Mass Destruction, talks about the use of algorithms and how it shapes the way we behave. The example that she starts with is the U.S. News and World Report ranking of universities, which didn't exist, 20 years ago? I'm going to say 20 years ago. Didn't exist a while back. But since then, and since with that system, there are particular metrics that whoever is doing this looks for to say these are the top schools on these metrics. Once those metrics existed, the universities, I'm going to oversimplify this, through their own decision-making, their own guidance overboard, and went for those metrics because they wanted to be at the top of that list. So now they forfeit their own wisdom, their own internal compass of what they're going to go for, because they want to have the top research dollars, they want to have the top SAT scores, you name it. So having an algorithm that is telling you what to do can not only take you off of your mission and put you on somebody else's mission, but algorithms can also, if they have built-in biases, exacerbate discrepancies or disparities. The income disparities in developing countries are huge, huge. I lived in the Congo way back when it was called Zaire, and lived very near the village of Joseph Mobutu, who was the president. I was living in a mud hut. An hour away was his airport that could land a 747. It was a huge expanse of asphalt back in 1980. That's just a glimpse of the kinds of disparities that can exist in these countries. Now, developing countries have those disparities too. We have them, but in a developing country where there is less of an ability to keep, let's say, an authoritarian government in check, then it's harder to control those algorithms and those decision-making processes. Disease surveillance is something that my project works on, and what I wonder about is that the first step towards a surveillance state? This is a news article from China that talks about how Beijing has 100% coverage of camera views of the public areas. And it's at a high quality, so facial recognition. So if you jaywalk, you're going to leave this library, you're going to jaywalk over there to the School of Public Health, and your photo will be taken, it'll be shared with your supervisor, and you could be chastised for not being a good citizen. Perhaps your salary is somehow docked. The surveillance state, the distance between the surveillance and the surveillance state is something that's one of my anxieties. And I'm not even going to talk to you about simplifying complexity and seeing like a state. There is a book on the topic, and these are the 4 aspects that he says lead to this oversimplification. The simplification we're talking about at the moment is the digitization of our world. I wanted to end with where we should go. I'm in an academic setting, so I'm going to talk about what I know. I've also been involved in public health ethics. As I've been involved in public health ethics, writing the code of ethics for the US in public health, I've seen that there are 3 major voices. There's the philosophers, there's the lawyers, and the public health practitioners. And we're now seeing enter into this mix the IT world, because they are on the forefront of where the ethical issues are arising. The academy, UNC, could be at the forefront of exploring the issues in those ethical questions. The challenges we face are that ethics research is not lucrative. In most schools of public health, ethics is not owned by any department. It often falls through the cracks. Research ethics, which all of us who are doing research have to do, we all are going to say it's necessary and it's good, but we also all feel that it's a big drag on our research. It can postpone a study by a full year. Advances in technology are quickly outpacing our wisdom and quickly outpacing the speed that the academy moves. Academics is notoriously deliberative and slow-paced, and IT is notably not that. And then digital advances are often very seductive. When they occur, it's, they just dazzle us, and it's really hard to try to restrain them. And digital devices or digital technologies abhor boundaries. They're trying to go wherever they can to get whatever data they can. And that's a lot of fun. That's a lot of power. It's very intriguing intellectually, but it also dazzles. And in that dazzling, we can lose track of the ethical issues. So I think my time is done. Are there questions? Yes.
A friend of mine once defined fun as power without responsibility. Would you consider ethics to be responsibility plus accountability? How far would that go?
Well, so one of the things we talk about in ethics is that no matter how many ises you can describe, you can't pile them all together to get to a should.
Okay.
Right? So an is describing what is, but ethics is going to go into what should be, and that leap between what is and what should be does go into the realm of responsibility. But then it begs the question: responsible to whom? When our country wrote our Constitution, the responsibility was to white men, or white male landowners, perhaps even. So the circle of who we say we are responsible to is a changing thing. Other question? Yes?
I love your point on U.S. News and college rankings, and it absolutely happens in healthcare, and it brings up a big point that the definition of a measure, the definition of an algorithm by which organizations are going to be measured, or individual doctors or patients, is a very powerful and ethically fraught process in itself. I even happen to contribute to what used to be the Solution 100. It's now the IBM Watson 100 top hospitals, and have no illusions that is a rational, dispassionate process. It is fraught with politics. And
that book, Seeing Like a State, that I zipped by, the root issue in Seeing Like a State is the state wants to govern and to guide. It needs to simplify the complexity. So to simplify the complexity, you begin to order things. And they talk about in this book about the ordering of intentional forests, because there's a lot of deforestation in Europe. So they reforest, and then the reforestation, they have these pictures. You look right down these lines of trees. It's like a Christmas tree farm. And we're doing that with algorithms, where we make these decisions about the way things need to be so that they are predictable, so that we can control without having to deal with the complexity. And the author of the book argues that you have to allow for the complexity. I mean, that's where life is. That's where life is, all that unpredictability. Which is not to say don't have the digital systems, but it is to say that we need to have allowances for overrides, like one of the examples that you gave. Yes?
So a lot of these industries that are having to do with these ethical questions, they're taught from a simply objective lens, right? Medicine, law, IT. So from an educational perspective, and being in academia, what's your perspective on how you integrate ethics into a curriculum or into a conversation for seemingly objective settings?
I've had a lot of failure in that. I've been involved in that kind of quest for some time, and have full appreciation for a couple of approaches. One of them is you have a designated program, that you have ethics on the title, and you bring in different people, and you have rich conversations. But then the danger that you face there is that ethics becomes othered. And then the other approach is to bring it into every topic, everywhere, which you want, but you then need to have faculty, staff, others who are trained in ethics. And then that training becomes a requirement, and then it becomes resented and implemented in kind of a patchy way. It's a really tough question. I'm just gonna have to say, I don't know. I've tried them both. Yes?
Just in response to that question, Johns Hopkins Medical School about 7 or 8 years ago reformulated this curriculum we call Genes Society, and they explicitly integrate healthcare disparities from the very beginning and kind of it's throughout the curriculum. And I think the intention of that is to say, whatever cool precision medicine thing you're doing, whatever that is, ground yourself. And that strikes me as a practical way for maybe medical students to think about practical concerns, is if you know that everybody's not getting their fair share, you have to step back and ask the questions why. And that's just as important as whatever cool genetic thing we're doing.
Medea.
Yeah, and I would just add, I absolutely agree. I think one of the opportunities, though, is to also capitalize on the interprofessional education initiatives that are going on. Because from an educational perspective, the concept of just being able to bring our students together that are representing a variety of disciplines, I think that is such a prime opportunity to start building in ethics. So it's not necessarily a course, but if we start developing those habits of inquiry and the habits of learning, so that regardless of which discipline they are situated, whether it's in business, whether it's in medicine or public health or dentistry, regardless of that environment in which they end up, they're going to approach things from that kind of varied perspective. And just having multiple opportunities, I think, has been one of the things that's been really interesting.
There was another hand over here.
Yeah, I'm sorry, I arrived late. If you covered this, forgive me.
I did.
Your last and brilliantly. When you were talking about the pernicious effect of the algorithm, I'm wondering if you have anything to say about the ethical problem with defining information or knowledge as data. Comes from a Latin meaning a given thing. That is, the thing on 6, 7 is 7, not 5 or 8. I skipped 6 because 6 is afraid of 7. When you talk about information that way, because we all know that all information, no matter how represented, requires interpretation. But when you talk about it as data, rhetorically, there's a claim to authority, to knowing what it is. And I think there's a lot of effects that has. Do you have anything to say about
So actually, I did cover that.
Okay. Well,
No. You've added another layer that's very helpful. But I was talking. The title of my talk is just pixels, which is related to your point that it's just numbers, and we can fail to imbue moral or ethical meaning to those numbers, and that's part of the exercise that we need to remember, that these data reflect entire lives. And there's deep meaning in them that we have to be very careful with. I'm supposed to stop, I think. You got 1 more minute. I got 1 more minute, so here I go. So I wanted to get back to how we learn ethically. And this is an inadequate answer, but I think it's worth noting. We were talking about how to systemically do that within an academic system. I want to say that I've come to a point that I've done a lot of teaching of ethics. I love doing those lectures. But where we learn ethics, most ethics matters. So, and that's something that each of us can do. So I'm empowering you in that regard to convey the ethics that matter to us. I think I need to stop. Thank you.